Chairman Pallone, for holding this hearing, and to all our witnesses for your patience today. In addition to efforts related to the research, development, and manufacturing of a COVID-19 vaccine, there will also be work needed to ensure that the vaccine is widely adopted and equitably distributed. Specifically, decisions about the allocation of the vaccine, efforts to support provider training, public education, and coverage considerations to ensure that the vaccine is not only available, but available to everyone in every community, including communities of color, among immigrants and refugees, those living in rural areas, and of course, our elders. In the absence of a vaccine plan from the administration, I'm concerned that attention to this necessary work is being overlooked, and we will repeat the errors and mistakes that were made earlier in the pandemic. Admiral Giroir, the framework and documents HHS has released do not address these details and other factors that will be critical to reaching COVID vaccination rate goals. Could you comment on that and the bipartisan letter that this committee called on the administration to create a national COVID-19 vaccine plan?
Thank you, ma'am. Very important question. I am not on that work group. That is Dr. Redfield and I believe Dr. Fauci, and they can answer that question for you.
Great. Thank you. I'd appreciate it.
Thank you very much, Congresswoman. This is a critical area. Just as Dr. Fauci has commented how important it is that we've begun to take the financial risk to have these companies be able to start manufacturing.
I understand. I'm sorry to interrupt. Your time is short and the day is long. Admiral Giroir, what I'm asking about is not the creation of the vaccine. It's a national vaccine plan to equitably distribute the vaccine.
Right. I
have legislation to require the administration to create a plan on the equitable distribution. Yes. That's the focus of my question.
Yeah, the quick answer is that is part of the overall working plan, and it's in development.
It is not available at this time. When can we expect that it will be available?
I'll have to defer that to the Secretary of Health and the Secretary of Defense that are in charge, but I can tell you that's an essential part of the current plan to develop the distribution strategy that will also address the equitability issue.
My understanding from when Dr. Eric Bright came before our committee is that it could take up to a couple of years to manufacture the materials to administer the vaccine, and that those plans had not developed. Do you know about the manufacturing of the supplies to deliver the vaccine?
That is currently a plan that is under the purview of a combination of General Gustav Perna, who is one of the co-leaders of the Operation Warp Speed. He has been specifically brought in by the Secretary of Defense to work with the Department of Health and Human Services to make sure that not only the vaccine itself is equitably distributed, but also that all of the material that's needed for the proper distribution. So this falls under his purview, and he was specifically brought in by the Department of Defense to address that issue.
And do you know if there's a plan to promote public health messaging and materials to counter vaccine hesitation in the country?
Yes, that's a very good question. I'm glad you asked it, and I have the opportunity to answer it. What we are doing is a combination of a couple of things. We're employing our community activist groups that we had originally put together during the days when we had the HIV group, and they are now an important part of all of our clinical trials networks. So we're going to employ the community outreach mechanisms that we already have, but also the CDC traditionally over the years has been very heavily involved in making the prioritization, which usually is the most vulnerable people first. But I'll let Bob talk about that.
I'll just say very quickly that we're very involved in the critical area you brought up in developing the communication strategy. It's going to be fundamentally critical. As well as I mentioned already, we're working on developing the distribution strategy but the communication strategy is very important, and it needs to, it will be beginning to be operationalized soon, just like we're getting ahead on the manufacturing.
Thank you.
Thank you. My time is up, and I yield back. Thank you, Mr.